Hi everyone, I'm Danielle Matias here at Caring Medical Florida. Today we're talking about Pes Anserine Bursitis. So recently I had a patient ask me if we would do a video on the Pes Anserine. So here we are. The Pes Anserine is actually a tendon that attaches on the medial side of the knee, or kind of the inside of the knee, and it's really a combination of several tendons that all conjoin there. The Pes Anserine can degenerate as we get older and cause pain, but sometimes even in younger people, if there is a joint instability component, that Pes Anserine tendon kind of gets overworked and underpaid as it's trying to help provide more stability to the area, and in the process, the bursa around there can get inflamed. So bursa are little kind of tiny fluid-filled sacs that we have around our joints that help to decrease friction between the layers of tissue. So they're not meant to be like these big pockets of fluid. When they swell and they take up more room than they should, they can be very, very painful and actually make it really painful when you're walking. When somebody has Pes Anserine pain, or we suspect a Pes Anserine bursitis, one of the things that we'll look at with ultrasound, aside from looking at the actual tendon and the bursa, is whether or not that patient has joint instability. And what I mean by that is we'll actually use ultrasound to look at the bones in the medial part of the knee to see, hey, if we do a little bit of a stressor maneuver, are those bones moving more than they should? So like here, these are the two bones in your knee on ultrasound. This is the meniscus here, and then you've got your MCL, the ligament that holds those two bones together. So we'll actually watch Dr. Hauser do this. And what we're looking for is, you see how these bones are moving a lot as he's doing this kind of valgus stress? This is actually an example of joint instability. And so when that happens, again, that Pes Anserine, because it's that kind of tendon attachment, can get overworked as it's trying to help provide stability. There's a direct reflex in your body between your ligaments and your muscles. So if your ligaments are injured and they're stretched out like we're seeing here, and they're not allowing, or they're not strong enough and able to provide stability, then your muscles will kick in. There's that direct reflex where your muscles will kind of step up and try to spasm and tighten, trying to provide stability as well. Well, that's not a great thing to happen long term, and this is what I often say in the office, is those muscles then and that tendon attachment, the way the muscle attaches to bone, oftentimes gets overworked and underpaid, and it will start to degenerate and wear down as well. This is just another view on how we test for medial knee instability in the office. This is the maneuver that we're doing, and then we can see it on screen. Most recently, I had a patient actually that came in and did have medial knee instability, but also had a true Pes Anserine bursitis. This is his ultrasound here. So again, this is kind of flipped from the last one, but these are the bones here, right? This is the meniscus, and then we've got the Pes Anserine, and then this bursa right here. See this black? That's fluid in that bursa, okay? So you can imagine, if anyone has ever had bursitis that's listening to this, it can be very, very painful, especially anytime that you're using the joint. So like you're walking, bending, trying to, sit down or stand up. And on its own, you could definitely talk about doing a steroid shot or things like anti-inflammatories for calming down the bursitis. But what happens is, if that bursitis keeps coming back, then we have to look at the underlying tissue and say, okay, what else is happening with this knee? Could it be an activity that you're doing that's flaring it up? Sure, we should talk about that as well. But if there is a knee instability component, we also have to talk about resolving that in order to get this Pes Anserine bursitis to calm down and even get that any Pes Anserine tendon degeneration to heal. Oh, this is just another picture. Again, it's kind of flipped again, but of fluid in that Pes Anserine. And then what we actually did was we did some injections, which you'll see here. This is my needle coming in, and we did some prolotherapy to the MCL and also to the Pes Anserine, and then injected some numbing fluid into that bursa to get it to calm down. Sometimes what we'll do too, just to confirm if it is the Pes Anserine that's causing the problem, or is that just kind of a secondary thing, is we'll do diagnostic blocks. We'll say, I'm just going to take some numbing, we'll inject it into the bursa, we'll inject it into the tendon, let it kick in for the next few minutes, and then go walk around. Is it better right away? Well, okay, then we know we've confirmed that that is the big pain generator. If it's not, if we numb the structures really well and the patient walks around and they're like, gosh, my pain is still 8 out of 10 or whatever it is, then that allows us to gain more information and keep looking. Is it really a ligament issue or something else at play that's causing pain in that area?